Hey friends on Facebook and YouTube and Pub Theology, welcome to another edition of Online Pub Theology. We've been doing this the last couple of weeks where we've been talking to community leaders, various clergy about our community, the COVID pandemic, and our responses to it. I hope you're doing well. Our prayers are with you during this time. But when I say that, I really hope that your prayers are answered by action, that we're all together in this, that we're serving each other regardless of what belief system you might have, that we're in this together. Not only here at what we talk about at Pub Theology, but in all the daily activities we have by sheltering in place and being connected in various different ways online. So welcome. Again, you're watching Online Pub Theology, kind of what we're doing in this time of social distancing. Today, I have a pretty cool group with me, and I'm going to bring them up right now. I have my co-host, Bekah McNeel. She's with Christianity Today. She's a reporter and editor there. Great international magazine. I have Silvia Foster-Frau from the San Antonio Express News. I have Joey Palacios from TPR, a section of NPR. And I have Roseanna Garza with the Rivard Report here in San Antonio. All three of them, or really four of them, have been covering the COVID pandemic since the very beginning in different ways. And we're going to talk to them about how this has affected them both professionally and personally in this time. And they've had great stories about this, and they all covered a little bit differently, from health to immigration to radio, all the different ways that they cover this. So I'm going to introduce Bekah, and she's going to begin this conversation. So again, welcome to Pub Theology Online. If you have questions for any of these people, you can post them in the comment sections on Facebook, and we'll see them pop up, and we will try to get to those questions. So again, we have to remind people, please ask questions that you might have to a specific reporter or to all three of them. So Bekah, thanks for being here again.
It's a pleasure as always. Well, so I am really just curious to start it off.
Questions for any of these?
Oh, there's the delay. So I would like to know about when in your coverage did you have kind of a moment maybe of personal pivoting? We've heard that word a lot. But where you started to think differently about the virus and the pandemic and the crisis and all of that. When did it go from being something that was a news item to maybe something that was more something that got you personally rattled, or where you maybe made a change in your own personal behavior, your own social distancing? And then if you can connect it to a story you were telling, I'd love to share that story out to our pub theologians. So yeah, let's just go one at a time. We can start with Silvia and work our way around clockwise.
I think for me, the biggest shift was probably when the story left just being our health reporter's story and became the story that everyone in the newsroom was covering and affected by. Before it was kind of a newsroom-wide policy, people had started kind of leaving from the newsroom because it was safer to work at home. And I think that was when, when your work basically forces you or makes the story everyone's story. I think that's when it really hit me, that this was something bigger than just one aspect of society, just like it was bigger than one beat reporter's story. This was becoming an all-encompassing issue for us.
Yeah, that makes a lot of sense. I do think there was some scrambling on the part of newsrooms to go, okay, at what point do we cancel everything that we were going to do and kind of halt production and change to COVID? How about you, Joey?
Similarly, COVID-19 coverage was in the wheelhouse of our military and Veterans Affairs reporter and our bioscience and medicine reporter. And so that was their focus for the first few weeks. I'd probably say January going into February. For me, when jumping into this, the day was March 1st. It was a Sunday, and that's when the city had announced that one of the patients from Joint Base San Antonio was released from quarantine. Excuse me. was released from quarantine, and later on, a third test result came back as positive, and they had to be brought back rather to Lackland. And so, that night I had actually called the mayor, and we did a quick phone interview, and it was the next day that the city held its press conference, and had detailed that person had gone to North Star Mall. And you could feel a moment in the room where there was just like this dense air that just dropped among the press corps that was in there. And suddenly a lot of the shift came to, this person who had tested positive and was very unlikely to spread the virus, had gone to a very public place like North Star Mall. And to me, that is when things really started to shift. I remember filing something with NPR that night, that they had gone to the mall. After that, the next day was Super Tuesday, and so we shifted. And we had an election at some point during
it's still happening, I think.
And things start to get blurry after that. But I remember doing close to just under 35, maybe 40 stories in March, and but there's more than usual, and all but 3 of them were related to COVID. I think it was the next few days, about March 6th or so, that people in Texas started to take it very seriously when South by Southwest was canceled. That was the pivotal moment that really shook Texas. And then a week after that, if I'm not mistaken, we had our first travel-related case in San Antonio, and then all of the ensuing public health orders that came after that.
Yeah, I remember walking with my phone into the bathroom where I was brushing my teeth and showing my husband about the North Star Mall thing and being like, oh my gosh. Roseanna, tell me, I've seen your byline a lot lately. It's you have been pumping.
Yeah, it's been super busy. I don't know what Joey shared, unfortunately, due to a technical difficulty, so hopefully we don't say the same thing. But for me, I think the thing that struck me right away as health reporter is that people cared so much about it so quickly, and that is something that definitely is not always true for health concerns or things that are health related impacting San Antonio. I think that the thing that stuck out to me the most or made me the most concerned and start paying attention to it right away was when it was very early on and officials were pretty concerned about the level of communication between the local and federal government officials, and how they had concern that, things were going to unfold very erratically because there was a lack of communication, or that we got all of these people who evacuated from China, but then they weren't going to be treated on Joint Base San Antonio Lackland, which is, things that they couldn't plan for. And that's when I feel like it became serious for me, because you could tell that we were going to be in it for the long haul, and have been. And our whole staff is also working on this. And so it's really impacting everyone.
Yeah. And related, I'd love to, we're all fairly young, and I definitely, this is our first global pandemic. Let's just put it that way. Let's go around for the last one. But tell me about how it's made you think about, all of us are pretty thoughtful about the role of the press in ordinary times, as far as, keeping the public informed, holding power to account, and all that. Tell me about how you've seen the role of the press during this time. And anybody can jump in. I'm not going to punt it to you. If Joey jumps in first, I'll let Roseanna know that he's in. But
I kind of want to collect my thoughts.
I would say as health reporter, this is really like the most communicative and easiest thing that you could really get information about in the beginning. But that over time, I think the lack of data that we had wasn't ever really going to catch up with the amount of information that people were needing or wanting. And so I think that this is definitely something that I feel people have been paying attention to. And again, I won't beat the dead horse, but definitely more so than any other health issue that we have facing our city. And of course, because it's a novel virus and people want to know more about it and make sure that they're informed. But I think that they've been communicative, and that in any way that they really could, and that the information is kind of that we have available, or the data is slow to catch up with the demand for it.
Yeah.
I've noticed in our coverage, we do a lot more now, like kind of lists, or just like, here's the number to call for domestic violence issues, or here is a hotline for, or here are the different places that you can get food for free, or here's what you need to know today. Like, we're having to do a lot more, basically just like very basic kind of public service announcements to try to spread the word about places people go, numbers they can call, ways to get tested. Like in kind of we've had to be more creative with that, right? Than having like kind of your classic article with a, person to represent this phenomenon and your nut graph, and then going into detail. Like, it's a lot more just like kind of basic information that people need to know right there, right now about the issue. And that's something that we've kind of had to be flexible with and quickly change around. But I found that to be pretty different than in any other kind of coverage area. And then like the other issue that I think that has come up for us is like, well, then how do you cover something that's dangerous to leave your home, when that's like one of the big parts of our job, is that we go out and talk to people, and you do all these things that now are like kind of dangerous, both for us and then for other people to have us out there, so that's like a weird thing. That's distracting.
Sorry, I just saw Roseanna's dog.
Yeah,
that's like
yeah.
hard to grapple with, though, as a reporters that are used to just kind of charging forward with the story.
And echoing like what Silvia is saying, that there's been a lot more focus on the rapid evolution of how this story is progressing, because a lot of the stories that I do now are trying to update our live blog. I don't do as many in-depth features as I would like to, just because every day it's my responsibility to attend the mayor's press conferences, or mayor and judges press conferences. So there's more of a shift in getting the day-to-day news and updates out there than actually focused on some of the features reporting that we normally do here. I going into the role of the press, at first it kind of felt like it was difficult to get people to take this seriously. There were folks who were there were certain big media outlets out there that were telling people to not take this seriously, and I think, going back to what I was saying earlier about when people started taking this seriously in Texas was when South by Southwest was canceled. Where Texas is a hurricane state. We see hurricanes start coming this way, and then all of a sudden head off to another state, and it doesn't affect us anymore. And I think some people may have had that mindset that it may not have been as big as it was going to be. But we're taking a direct hit from this hurricane that is COVID-19, and unlike hurricane coverage, which I'm sure each of us has done, there's the prelude, the preparation, the understanding that it's going to end soon, that this storm is going to pass. There is no way to predict when this is going to pass now. This is going to be the way we cover things for at least in my perspective, for the foreseeable future, because we have these public health orders in place in most cases for the next 15 days. I think it's very unlikely that these orders are going to be excuse me, there's going to be scaled. They're going to be scaled back. Right. It really is like the new normal. And I feel like now people are adjusting to that, and it's our role as the press to make sure that people have the most up-to-date and current information, so that way they can start making the decisions that they need to for themselves.
Absolutely.
We do have a question from Aaron Chamberlain, who says, do we know how the homeless population is being taken care of? That's something I know well, but I'm going to let a reporter answer that. Has anybody been covering the homeless response in San Antonio?
I haven't covered it, but I just read today, I know they're making an effort to put, I want to say it was up to 400, y'all can correct me if I'm wrong, folks into hotels that have become vacant. And so they moved in 78 homeless people from Haven for Hope into an undisclosed hotel location this week. And I think they're going to try to ramp that up. And I'm pretty sure the city is paying for those rooms. But
They are.
Yeah. And so like, that's an example of, the homeless people are especially vulnerable to it, and they live in close quarters, and it can spread quickly there. And that makes us all kind of vulnerable when they are vulnerable to it, right? Because it augments this community spread. And so I think that's their way of kind of giving them a temporary place to stay, while also helping out these hotels that have also been suffering from a lack of guests there.
Sure. Yeah, and they're also opening up hubs that we've learned about. We help support the hub at Santa Rosa, or outside of Santa Rosa Hospital. There's a parking lot there by San Fernando Gym in downtown San Antonio. And 5 days a week, Corazon provides warm meals to that hub. There's other restaurants and industry workers that provide the other days of the week for that hub. And then every hub is kind of operated in different ways. But the city has put out flyers and hotlines to communicate where homeless people, marginalized, and really anybody who might need a meal or any type of service. CAM is providing showers and other services. So there's different hubs around the city that the city is now supporting through the Department of Human Services. And all the nonprofits are kind of working together through DHS to figure out where their best place might be. So any other thoughts about the homeless response?
The city has detailed some of it, but they're not revealing the location of where these hotels are. There's two separate hotel initiatives that the city is doing. One is isolation rooms for people who want to be, or who have either tested positive and want to be away from their family to keep from spreading it, or people who are afraid of getting it. So the city has these isolation rooms set up. And yesterday, the mayor had said that they were at different locations throughout the city. And I had asked if, these were the same rooms that were being used for the homeless population. And their answer was no, that they do have separate areas set up, different rooms to house these folks if they feel unsafe. That's
right. And we also are preparing, without getting too much information, other locations for people who might be homeless that may not be sick. So there's kind of a different response for somebody who might need shelter in a safe way versus somebody in the homeless population that might get sick. So there's also different ways that we're approaching that. So the city's done a great job. I encourage you to, if you want to learn more information, just contact the Department of Human Services or SARA, this South Alamo Regional Alliance for Homelessness, I believe that's what it's called. And they've done a great job with that as well. So thanks for that question, Aaron. And we'll move along. Silvia, I do want to talk to you a little bit. This is Pub Theology, so we'll put a little bit of theology back in here. You've been covering Sutherland Springs from the very get-go when that tragic shooting happened a few years ago. And you've gotten to know that community very, very well, and really have told that story in amazing ways, probably better than anyone else in the city. And now recently you went back to that church after Governor Abbott kind of said that churches are a essential service. And tell us a little bit about that coverage and what you learned.
So I went back to the church about 2 weeks ago, I think, not this past Sunday, but the Sunday before, because they're still holding in-person gatherings there. And so, after Governor Abbott, he basically said that they were an essential service, but then also added later on that if you do have the ability to live stream, that you should be live streaming. So there was like kind of confusion about that, but kind of regardless of that, Sutherland Springs, which in 2017 was a site of a deadly mass shooting. It's like a small town about 45 minutes from here. They chose to keep gathering. The numbers have significantly dwindled, so they can hold in they have a new sanctuary that was donated to them, and they can hold about 250 people, and that's about how many people have been showing up since the shooting. And so I went down there 2 weeks ago, and there were still probably around 50 people attending church services, lining the pews, walking in, grabbing the bulletin, going to their usual spots, services kind of as normal, even though they've had live stream capabilities for years. So I just went to report on it because I thought it was interesting. Not only is this church choosing kind of against public health experts' opinion on what you should be doing, choosing to hold in-person services, with the backdrop of the fact that a lot of these people are survivors of a horrible mass shooting that killed 26 people. They're a tight-knit church. They're all friends and very close family. And so, I just report on the story to get a sense of, why are they doing this, and what's the motivation behind it, and what is there to understand about why they're still holding services, which they still are today. They held them last Sunday too.
Yeah, and Joey, we're getting some comments here that you've covered Sutherland Springs too. Why do you think they are determined to meet as they are meeting? What in their best case scenario in your mind? What are they thinking?
Well, as Silvia was saying, the Sutherland Springs is a very tight-knit community, and it was even more tight-knit after the shooting. And people of very religious backgrounds, they want to make their backbone is the church. That is their connection to the community. That is what keeps them grounded and binded together. And so for a lot of religious communities, I can see why they still want to hold church services. Here in San Antonio, the city and county are really emphasizing religious houses of worship to hold distance services when they can. And from what the mayor and judge have said, many of the churches and religious houses here are doing that. It's only those that don't have the capabilities to do that may still have in-person services, which, if I'm not mistaken, that was in part of the governor's order. But for small towns like Sutherland Springs, and we're saying small, but this is a population of about maybe 400 to 600 people, that they need that anchor. They need that ability to stay connected with people, and that is within the church. So I think for not just Sutherland Springs, but a lot of rural communities, you see this this need to be with the people that they have depended on for so many other grievances in life, and especially with the massacre that happened within the previous sanctuary there, that a lot of people within Sutherland Springs gather that strength from each other, and they want to not lose that sense and that grounding of who they are as people, spiritually. So I can understand where some religious organizations want to make sure that they keep that contact time with each other, and it is very important that social distancing absolutely has to be maintained. I've been shouting that from the rooftops on social media and even on air here, that people need to have the space buffer between them, because that's how this virus spreads, people being close to one another. So it's a very double-edged sword, to where you have these tight-knit religious communities that want to maintain and keep those social bonds that they have, but at the same time they need to observe these boundaries between each other to make sure that they are keeping others within their community safe. And it is a very, very, very hard thing to balance.
Yeah, as a pastor of a church, obviously we miss a lot of connections, and there are groups, recovery groups, AA, other dependency groups that really value in-person contact, but we're really encouraging those groups to do online connections, talk to their mentors, talk to their coaches, and really stay connected, because that's one group I've heard that really, really wants to go back and meet. I even heard that, I think, when the Rivard Report covered the Extreme Harvest group in San Antonio, whatever that church called Extreme Harvest. It was one of the reasons they said a lot of people in our church are in recovery. One more question about that, Silvia. If you compare it to the tragedy they had at Sutherland Springs and the risk they've already kind of experienced in just losing so many people, how do you think they balance that versus this current risk? Does that play into a fact that they already experienced so much tragedy? What is their current sense of this type of tragedy? I hope I'm making sense there.
Yeah, I mean, I hate to put them all in a box, but I did hear a lot of, if God didn't take me then, he's keeping me around for a reason. Or a sense of almost fatalism, like, if it's going to happen, it's going to happen. There's nothing I can do to control it, because that really was the sense that they felt after the shooting. It came out of nowhere, and they just had no sense of control over it. There was nothing they could do. They were trapped inside this sanctuary, while a gunman is just killing all of their loved ones, and so I think there's also just this sense of a lack of control, and this kind of fatalistic, if it's your time, it's your time. And I think that's really hard to reconcile with this kind of invisible enemy that we have right now, who isn't a person. There's no name that you can point to. There isn't a physical thing that you can see and say, this is what's killing people. It's so much more subtle than that. And you try to stay 6 feet away from people, but it's not like you can see the infection in any way. So I think it's really hard, even for everyday people, or for me myself, to wrap my head around what to do to be safe, and what exactly this virus is. And when I go to the grocery store, where do I put my hands and not put my hands, and make sure I don't touch and don't wipe? It is a hard to grasp, this kind of invisible enemy. And especially if you've gone through something where the enemy is right there in front of you and is very tangible, this can seem so abstract. And to Joey's point, faith and each other was what got them through the mass shooting. And so this is what they use now to get through this other sense of fear. And we all can understand that in a small way, Now's the time when you want to be around people the most, when there's this fear that something is taking over the world that you can't see and can't explain. But it is so important that we, use this amazing technology that we have these days to try to stay connected, and take proper precautions, so we don't have to be more scared than we are now, and things won't get worse than they are now.
Yeah, people of faith and communities have to balance risk all the time. People see it as a great mission, right? A lot of churches see what they do as a mission. So if their mission is to go to a country that might be dangerous, they have to weigh that risk. If they go to a population that's or a country that might be intolerant to a certain faith group, they still find it's worth their mission to do that, even with great risk. And so I think a lot of people see it that way. And I would encourage people to see the mission kind of in reverse, that we're actually protecting people. We're making our mission protecting the ones we love. And if you believe that everybody has this divine nature about them, that they're all images of God, or whatever your belief is, that your mission should be then for protect that. So there's different ways you can see mission, but I think all this is wrapped up in how churches are responding, and it kind of says a lot about their belief system. But we'll move on from that. But thank you so much for taking time to discuss that. I think it's an important thing a lot of people connect to and had questions about. I want to get to Roseanna. Roseanna, you're on mute, so if you can unmute yourself a little bit. Roseanna is also not only the health reporter at the Rivard Report, she's also a licensed therapist. And I do want to talk a little bit about just ways people can stay healthy during this time. When people are alone, when people are starting to get depressed, when people are anxious to get out, what are some ways and things that you encourage people to do to stay healthy during this time, so their mental health stays pretty secure?
I think that people at this time really should tap into whether or not maybe they're over-consuming the news about coronavirus, depending on how much anxiety or fear they have personally about what's going on. There's really no one thing that will help all people when you're feeling overwhelmed, but I think, trying to stick to a schedule and making sure that you make time for going outside and exercising. I think that there's, in mental health, it's kind of, you don't really want to over focus on anything, especially the things, we can control so many things. We can control how many times we wash our hands and how safe we are when we go out and practicing social distancing and all of those things. And then the emotions that come along with those, we have to reach out to our support systems and make sure that we're communicating our feelings or taking a step back and not, immersing yourself so much into the news. Take a break or a day off. I would definitely not pressure yourself to exercise more than you did before or have some dramatic life change in the middle of a pandemic. That's for sure. And so, be gentle with yourself and others. And if you're feeling overwhelmed or be like you need to reach out for support or take a step back, you should do that. And definitely get some fresh air in a way that is safe.
And I know you've done online therapy before, and a lot of therapists are now moving online. How does somebody get connected with that? I mean, is there a way now people can find resources online if they need to speak to a therapist or their therapist? Are there different resources out there to help guide people?
I think that at this point, usually what takes away from people being able to access telehealth services is that insurance companies they won't bill for it. They can't make money if you don't go in person. And coronavirus has kind of uprooted things so dramatically to where even, insurance companies and states are, mandating that people start seeing patients that way and that's something they can bill for. I would say it depends on what type of services you're looking for and your income level. But I know that I believe the San Antonio Metro Health should have a list of resources compiled that includes organizations that give sliding scale or free services.
Yeah, and one of those is the SA Hope Center. If you're really marginalized or homeless even, that's another question. They provide now teleconferencing or telecommunications with their counselors, and they're just teamed up with Our Lady of the Lake University to get more counselors there. So a great organization, the SA Hope Center by Megan Legacy. She does a wonderful job. Thank you, Roseanna, for talking a little bit about mental health, because that is something I think as it continues, even when this crisis goes beyond restrictions in the months to come, there's going to be a lot of people in this economic recovery that are going to need a lot of help and a lot of mental help to get through this. So we'll keep us updated on all that stuff. I am going to bring Bekah back in. We have a question about, and I'm going to try to find it again. Bekah, welcome. Somebody had a question about public schools, and I'm going to find it. Maybe, I hope I can find it. Did you see it, Beck? Oh, maybe it's gone. We'll move past that. Yeah, I thought I saw it. Maybe it went away. Maybe they deleted it. Well, we did have a public, so let's talk a little bit about that, Bekah. Let's talk about public schools and how the public school system is responding during this time, and people can respond to what they know. Uh-oh. We can't hear you.
No.
The joys of technology. Well, we'll come back in. So I'll continue with this. Welcome to Pub Theology. If you're now just joining us online, whether that's on YouTube or on Facebook, welcome to Pub Theology. I'm with three great reporters, Roseanna Garza from the Rivard Report, Silvia Foster-Frau from the Express News, and Joey Palacios from TPR, Texas Public Radio. And we're glad you're here. You can share this if you want to your friends and family. It's on our Facebook page, Pub Theology San Antonio. If you're watching it, you're probably on the Facebook page. So please share, and we'll get this message out to more people in the days to come. tell us a little bit about how y'all are covering schools or how you're learning about schools and their responses. Does anyone want to take the lead on that? Fortunately, Bekah's the education reporter, so until she's back in, I'm going to be winging it.
I'll speak for our education reporter, Emily. I hope that she does not mind. I think that schools were probably one of the, first major institutions other than public health that was impacted by this. It's pretty hard to social distance when you have a bunch of students packed into one room. And so I would say that, like public health, education officials, no matter how much you plan for this, you're not going to be fully prepared. And there are so many differences in the school districts and the systems which they use, whether that be to grade students or to, monitor their own practices, that they just have to figure it out. And everybody is rolling with it as it comes. And that's probably, arguably going to be one of the communities that's impacted the most in terms of resources that families rely on and how they're going to navigate through being graded in a home where maybe the parents aren't as able to help you with your homework or you don't have internet. And these are all now things and, disparities that existed before and are even more relevant now that we are in the middle of something that nobody, no matter what, really could have planned for.
Thanks. Does anybody have any other thoughts about education here in San Antonio? Maybe Bekah, are you back with us?
Can y'all hear me?
We can.
Yeah. Okay. So yeah, everything Roseanna said is true. That's oh, my family's here, so y'all are about to get to meet my kids, which will be fun. One of the things that I found the question he was looking for, and they're asking, what are we doing to find the kids who we haven't found yet? Districts are starting to tally up their contacts, and this is important for a lot of reasons. And we're seeing all the different things that the schools have become. We're seeing how they have become really one of the last safety nets that a lot of families have. It's where they get food. It's where they have access to eyes on the kids for kids who live in dangerous situations. They're an important hub, and now that hub is gone. And so finding in San Antonio ISD, it's 4,185 kids, and they are trying to figure out how they are going to find those kids. Are they going to go door to door and risk health for the sake of finding a kid who may be at risk? Hold on, there's a kid who's just curious. But the schools are going to be facing a lot of challenges, especially in terms of an economic crisis hurts schools as well. So there's going to be a funding conversation that happens when the ledge comes back. There's going to be questions of accountability of how do we, a lot of their funding and stuff is tied to programs that they're doing. And when you can't deliver those programs, how does the funding work? And right now, from what I'm hearing, most entities are being very gracious. Philanthropies, state agencies, everybody's being very gracious with like the reporting and whatnot. But at some point there will be a gradual ramping back up, and all of the inequities that made it tougher for some school districts to meet those requirements and whatnot in the past are only going to be harder. And so it's going to be something that's a continued, like when schools reopen, the story is not over. It's really midstream. That's kind of the midway point on this story. And so on that, I would like to ask you guys, for comparable things on your beats, what do you feel like the next stories are? What's obviously the economy is, doing what it does, but what is the story? What's the thing that you've got your eye on that you're thinking like, okay, what is the new normal, or what is the next wave? However you want to phrase it, what's coming next for X, Y, or Z?
So at the city, I feel like the big story that's already being talked about and is just going to develop more and more.
Hold on.
Oh,
Joey's going.
So the reason, as Roseanna can't hear all of us due to a technical glitch right now, but what we're seeing out of the city is what it describes as a catastrophic revenue loss, meaning that its sources of income, specifically the hotel occupancy tax, has taken a nosedive. People aren't staying in hotels, tourists aren't traveling, and that's where San Antonio gets a lot of its money. And so the city is having to make all of these adjustments, to including furloughing positions that are paid by that revenue source. So you see more than 270 employees at the city being furloughed. One of the biggest hits that the city that I found a little shocking is that the arts agencies that get money from the city are no longer going to be receiving disbursements for the rest of the fiscal year. And one of the things that we're supposed to be hearing about at council tomorrow is risk. It's a risk mitigation fund. My understanding is that they're going to be talking about some of the support that they'll be able to give to people who might not be able to make rent. So we're going to hear more about this stuff tomorrow. So one of the things that Mayor Nierenberg has put forefront since he took office was that he wants San Antonio to be a compassionate city, and one of the I think that commitment is really going to be put to the test right now, to see how much support the city is able, both legally and financially able to do, as people struggle with maybe the Texas Workforce Commission, with unemployment. So we're going to see how much the city is able to do, or rather, how much the city is able to help its residents, its citizens, through this crisis, because that is something that Mayor Nierenberg's administration has put through, is that, you know, they want to be this compassionate city where people aren't left behind, and we're going to see how much how much the city is able to do over the next few weeks.
Kind of what you said, Bekah, about how with the schools, how inequality is basically going to be shown very clearly, or even exacerbated once this pandemic kind of slows. I could see that being the same kind of across the board. So covering immigration, I think that's happening now, and will only get more apparent, where you see immigrants in the community who are already a vulnerable population, you know, really suffering from the effects of this. A lot of undocumented immigrants who have essential, you know, jobs deemed essential by the government, are also not going to be getting a lot of the federal aid that's being given to a lot of people to help recover from this. So you see, like, that population, for example, what's going to happen to them? Are they going to fall further into the cracks? There's also two other things, I guess, I'm keeping my eye on, is in detention facilities. And again, much like prisons and other places where you have people in tight quarters, really easy for coronavirus to get in and spread very quickly throughout the community. And so what's being done for those folks now, and what can be done for them? There aren't a lot of reported cases of COVID-19, but there's also not a lot of testing at ICE facilities. So you're hearing now about a lot of migrants protesting in these facilities about their conditions, and fearful that many of them do have the virus. And then the one other aspect is also what's happening at the border. I think one of the first reactions of this administration when the virus came was that the virus was not in the US, and that it was foreign. And so a lot is being done basically to, again, you know, there was the European travel ban, and there was more being done in place to basically secure the border, and using the virus as the reason to do that. So people being deported to Guatemala regardless of where they're actually, or migrants being deported to Guatemala regardless of where they're actually from. If they're from Honduras, Venezuela, they get put back into rural Guatemala. And so those probably are the 3 stories that I'm going to be following, and I'm sure there will be a lot more to know about in the coming months.
We're going to have some background noise because the riffraff are home. But they've been playing outside this whole time.
Oh,
So Can y'all hear me?
I do want to get to Roseanna. She had that. She
Yes.
did
I wanted to respond to Silvia real quick, just to say one of the things I was looking at a story this morning. I ran a story on Christianity Today about how people are nervous about the policy changes that are going to happen while we're all focused on COVID. There could be some emergency immigration stuff that happens that doesn't get removed once we're no longer in a state of emergency. So there's some things that could be done, maybe a little disingenuously, maybe by necessity, but that also coincide with some of the bigger goals of this administration as far as blocking immigration.
Yeah.
Okay, I'm actually gonna sign off now and go do bedtime and let you.
Thanks for being here, Becca. We're almost done.
Can you guys say bye? Can you say bye?
Laura, how are you? Good to see you.
Okay.
So cute.
That's adorable.
All right. So Roseanna, can you hear us?
Oh, it doesn't look like it.
I think she has herself on mute from what I can see.
I'm gonna try unmute mic. Roseanna, you're on.
She can only see me, and she can't hear.
Let's see. We'll make it happen here. We'll make this happen through the phone system here. Welcome to Pub Theology again. Thanks for always joining in. We are here with Silvia Foster-Frau from the Express News, Joey Palacios from TPR, and Roseanna Garza we're trying to get back hold of with the Rivard Report. Sorry for all the technical difficulty. So we're trying to get a hold of Roseanna, but we'll wait on that. We do have a question from actually 3 people have said this question is, how are y'all protecting yourselves? How's your newsroom? How's your editors and everybody protecting y'all from the COVID crisis? And what are y'all doing to protect yourselves?
So I wear a mask now every time I go out. I have gloves, so I don't. There you go. Joey will be our demonstration.
I have several.
Yeah, me too.
Oh, I should have brought mine over here. I have a Wonder Woman one. I think that it has presented a challenge, though. For example, when I went to the Sutherland Springs Church, it was difficult for me to figure out what protocols I need to put in place, and when I just needed to say, like, hey, can you step a few feet back, or hey, why don't we do this way? And learning how to be upfront about, keeping that distance, or asking someone to put their mask on if they have one, or doing those kinds of basic protocols when not everyone is on the same page and following the rules, I think is like kind of new territory. For me and for a lot of us, we're trying to make calls as much as we can, but sometimes you really do just have to be out there and telling the story. And so that's been something tricky to navigate, but I have been very happy with how my editors have always prioritized our safety. And if I ever said that I felt uncomfortable with going out and covering something, I think there would be an immediate understanding. So yeah, it's definitely new territory, I think, for all of us to try to navigate, how do you go out and tell a story while still maintaining your health, and not only, making sure that you don't get it, but also like you don't want to contribute to the community spread. They say like up to a quarter, up to 25% of people are like asymptomatic carriers. So for all you know, like you could be that person that's spreading it. So just have to be really careful and choose wisely your assignments, I think.
Yeah, Joey, what about you?
Well, here at TPR, our higher ups are making sure that the health is put first. When we usually would have about 14 or 15 people within our newsroom during the day, now there's about 6 of us, and we're all spaced out pretty far apart. The folks that are in the newsroom are just the folks that have to be here. The folks that are live on air, the folks that do producing for our live show. And I'm at the station just about every day because since we are in our new building, City Hall and all the council offices are quite literally across the street. So there's a lot of easy access for me to talk to the public officials, to attend the mayor's nightly briefings. So we do have a lot of social distancing policies in place. The station has started to provide us with masks. As I mentioned, I have several. I have the black one I was wearing a moment ago, and then one that my sister gave me. And one of the things now, and I'll show you, this is the microphone that I normally use. It's pretty close to, it gets pretty close to people. But now we are being asked to use these stick mics that actually extend and go pretty far to make sure that we get at least 6 feet away from some of our interviewees. And this one is actually pretty tight. So this one can get about a good 10 feet away from us. So usually after interviewing the mayor after council, this is what we'll end up using to make sure that we maintain that distance. And even the press gaggle, we make sure that we maintain a buffer between us to where we're not within a few feet of each other, just to keep those distancing policies in place.
Yeah, we're going to try to bring Roseanna back in. She was going to talk a little bit about a story that's upcoming. So we're going to bring her back in, and we're trying to communicate so she can share. So Roseanna, can you hear us? And can you share?
Wait, I need my friends to help me because I didn't hear Gavin's question, and I can't see him. I can only see him.
Yeah, we're going to bring Roseanna back in.
Uh-oh.
She was going to talk a little bit about a story that's upcoming. So,
I guess no one can hear you, Ro.
She can share. So, Roseanna, can you hear us? And share?
Share about an upcoming story?
Yes.
Sorry, it's super delayed. I wish that Silvia, tell me what he said. I can see you.
You're asking her about an upcoming story?
Yeah, she was about to say something over to when Joey was talking, and we were all talking about Bekah asked the question about an upcoming story.
Mm-hmm.
So, Silvia, can you tell her that? We'll interview.
Yeah, he said that he's going back to the last question when you got cut off. Yeah.
When we were all talking about what are some things that we'll be focusing on in the future.
Mm-hmm.
Right.
Yeah.
Well, I think that this has been a really important showcase of why we need to expand access to healthcare, and that tends to be what most health-related stories are about almost 100% of the time, which is, who's getting the infection, who's dying of it most, can people get the services that they need? With the coronavirus, I think that really the disconnect is that it takes a while to get the documentation that's necessary to provide people with the answers that they need, but we really do have data that tells us a lot of other major health concerns and things like that. I think that my personal interest will be, well, now what are we going to do now that we know something like this could take place at any time? Will Texas start focusing on expanding Medicaid and helping more people have access to services, or will bit like county hospitals and programs like CareLink have to expand, or how will the landscape change so that people are making sure that people will be able to get the access to care that they need, whether it be for a novel coronavirus or for anything else. I think for my colleagues and other people in the newsroom, where the bottom line of the story isn't usually can someone get the access that they need, will be, again, just, I guess, looking at how the landscape has changed. Definitely schools will operate differently. I think we're going to get a lot of nice data, and if not nice data, at least a nice storyline that kind of explains the importance of, following experts and making sure that you're making data-driven decisions. And that's not like a very fun way to talk about things, but we know about diabetes and heart disease, and we know the things that you have to do to reduce those rates. And people struggle with not going out when we're in a pandemic because it's hard, if you're not going to do the right thing, it's really hard to make someone do that, whether it be, trying to lose weight if you're, overweight in a way that's very unhealthy, or treatment for diabetes, and then can we pay for it and how? So it would be interesting to see how much more funding comes pumping into Texas for health. But I will be curious to see if that's actually something that takes place legislatively. I will not hold my breath.
Yeah, no, that's good. I think a lot of things like that are going to be pressured to change, right? We're learning, we talked about this a few weeks ago with Molly Cox about now that like evictions are being withheld, and all these different policies that we immediately just put into place. Like, how is that going to adjust again? How are we going to create new ways to better serve people? All this, I think there's some things that will boil up out of this, and hopefully healthcare is one of them in the state legislature and in Texas. So I do want to spend our last few minutes going around the room and talking about a story of hope. That we can talk all day about the tragedy of this thing, and it is a big one. But also we see, and y'all cover things that pop up that brings the community great hope. Silvia, what's been one story, and we'll go around the room. Silvia, what's been one story of hope that you've seen, either coverage that you've done or maybe any of your colleagues have done?
One of the things that I was really happy to see was after those kind of devastating images from the San Antonio food bank, where we saw over 10,000 people seeking help at our food bank with thousands of cars waiting in line. The first person that showed up for the 10 a.m. distribution last week was at 6 p.m. the day before. So just like, we first were like kind of bombarded with these images and this story of like real desperation and genuine hunger. And then seeing that being followed up by the hundreds of thousands of dollars that were poured into the food bank afterwards, and the community kind of rallying together to help the food bank have enough to serve its people, and getting the information out there about the other food banks available, or food pantries. That was like really uplifting for me to see. Our Shea Serrano, the writer and San Antonio native, he was like posting on Twitter and managed to raise over $100,000 on just that alone. And so I was just really heartened after being so upset about seeing those images, and then seeing the community rally so strongly afterwards. It like really made me feel like, okay, not all is lost, because at the end, like, people will try to take care of each other, and this is a virus that is affecting all of us in some ways bigger than others, but it is affecting all of us in some way. And so, the more we stick together and help each other, the more likely we are to come out of this okay. So that was really heartening for me to see.
Yeah, thanks for that. Joey, what about you? What is something you've seen that gives us great hope?
Well, when you asked the question, one of the first that came to my mind was the food bank as well. That there are just so many people who are willing to help sustain these agencies that are supporting people. The food bank wouldn't be able to do what it does without the number of donations it receives. It would feed around 50,000 people a week on a normal basis. But in a conversation I was having with somebody at the food bank today, they're feeding about 150,000 people a week now. So it's almost triple. And you're seeing support come in to the food bank and to other agencies that provide social services. And I believe that the agencies, the arts agencies and other nonprofits that will see less money from some of its more guaranteed revenue streams, maybe government revenue streams, that they'll hopefully see some support from the community coming in. So I feel like, just in my observation of the general public, that people are being kinder to each other. The people are taking a bit of a breath before they react to something, and that they're more willing to step up to help their neighbors. People, one of the things that I'm excited about seeing is some of these Facebook groups that are popping up with people saying that, oh, I can run groceries for somebody, or there's toilet paper at this one Walmart or H-E-B on one side of town. And so you're seeing a much bigger, a very big digital response to people wanting to help each other out. I've seen people post pictures that have like restaurants of what supplies they are selling. So there is a bigger desire to help people through this crisis, and I think that is what is giving me hope. Where some entities of government may not be helping as much as people would like, but that people like people ourselves are helping each other through this.
No, thank you. That's great. I definitely see that. One story that I've seen that I thought was really great is an organization called For Her. It reaches out to people in the sex working industry, and they are finding ways, these strong women that support this, finding ways to help women during this time that now are out of a job in a very tragic situation. Some people believe they're in a tragic situation already, and they're going around and they're raising money to help these women that are now without any type of source of income, and that takes a lot of bravery, and people are finding really creative ways to do that. So that's one thing that I was really impressed when I saw For Her posts about that, and about how you wouldn't think about that, but that is something that COVID affects, and these women are going to back these other women up, and I thought that was pretty amazing to see that rally. So I'm going to go back to Roseanna. I hope that she can hear us. Oh, you can hear us now. We're good. We're back live. So, Ro, tell us a little bit about a story maybe from the Rivard Report that brings great hope.
We've been trying to focus a lot on, we've all, I guess I should say, been trying to find people who are out there doing the most good that they can. And I think that our photographer, Bonnie, took some photos of a couple celebrating their 70th wedding anniversary. And that's very lovely. And people are figuring out ways to kind of still bring joy to themselves and hopefully others. I think some of the change that's been really good is how we've been able to see that, things like providing access, internet access to kids who need it is something that you really can make happen if you make the concerted effort to make things like that happen, and expanding access. And it is a good kind of omen for the future of, it adds to our data about exactly what we can and cannot do. And all of that will inform better decision making and be a good, talking point against anyone who would say that an expense like providing internet to children isn't something sustainable. I imagine that just like what we're doing now, we can make these types of things happen. We just have to figure it out.
No, that's great. I'm on one of the working groups for the county and the city for social services. And one thing that's come up out of this is citywide internet, that we can provide internet for the entire city. And maybe we can get that done during this crisis. And I think all these creative things are really interesting to learn about. One last question. We failed to mention this, and it's a good thing because we always need a break from it. But right now, people in the media are not getting treated very well by the President of the United States. Watching those press briefings is like watching some type of dark comedy take place in live action. How can the public really decipher what's really accurate news out there and some spin that we see, especially now that we're all on social media and people are now doubling their time? I saw 8 hours more a day that they're either streaming or on social media. So what are y'all, as journalists, this has got to be a personal thing for you, what can you tell us about the faith in the news. And we're in the stories, I'm sorry, I'm blanking out on my question, but I feel like a pair of brown shoes with 3 tuxedos. I'm interviewing some of the best reporters in town, and I feel so unqualified. But tell us a little bit about how you can encourage us with the news.
I would say right.
Go ahead.
I would say right now, it's especially challenging because you hear of a lot of layoffs and furloughs in newspapers and news organizations across the country. That's probably what's troubling me the most, actually, even beyond the rhetoric of this administration, is just really the financial loss that the journalism industry is receiving at a time when public information is crucial. It seems like this should be the last time when we're laying folks off. This is the most important time to be getting information out there to as many people as possible. So I'm really concerned about the effects. I think it's mostly those that are relying on advertising-based journalism and seeing the effects of that on newsrooms. People who are now operating on a system where 2 of the 4 weeks every month they're furloughed, and huge papers, closing down or laying off staff. So I'm really concerned about that. So I guess all I can say is, I hope people keep reading. I know that it's a really difficult time, and it's hard to, when you're looking at your budget, it's hard to know what to keep and what you need to shave off. But we're doing as best as we can to get really important information to y'all. And so I hope that, readers or listeners or viewers, depending on your medium, can see the importance in what we're doing and how we're really, we're trying to help you. We're trying to help you be informed about what your lawmakers are doing, about what the virus is doing, about ways that you can protect yourself and help yourself. And so, the layoffs of people that I would consider colleagues isn't just personal to my profession. I also really think it's detrimental to the public when we see that kind of shrinkage of news. So if you can't afford even just an online subscription, or you can't afford to donate to TPR, Rivard Report, or whichever way that you can to help sustain these news organizations, I would urge people to do that.
That's good.
Yeah.
Joey, I could go continue.
Yeah, no, I bouncing off what Silvia is saying is right now is probably one of the most crucial times to support the press, whether that is financially or whether that is through listening and sharing the stories that we produce. There are ways to support the news organizations that you like. Here at TPR, you can become a sustaining member. The Rivard Report is a nonprofit as well, and you can donate to it. And you can subscribe to the San Antonio Express News. You can, for instance, maybe click on a TV station story because that's one of the ways that they generate revenue as well. But we do this job because we want to make sure the public has the information that it needs to make the right choices for themselves. Journalists don't have an agenda. We want to make sure that people have all of the facts and that they feel confident in the information that they're receiving. There are news outlets out there that their goal is to spread misinformation. And to combat that, I would advise people to have multiple news organizations that you trust, whether that be NPR, TPR, the Washington Post, the New York Times, CNN. Have multiple stations multiple outlets that you trust, so that way when you do see information that seems a little weird, that you can go to one of those other news outlets and check and make sure, is that really what that person said, or is that context, what is the context with the story? And there's just flat out fake news out there that people share. Or one of my biggest pet peeves is that sometimes folks will share stories from 2 to 3 years ago that have a headline that looks like it's current, that looks like it might be applicable to something that's going on, but was actually something that occurred in 2016 or 2017. And so that can create misinformation. So, one of the things that I like to tell people is check the date of the story that you're sharing before you share it. Fact check something before you send it out there, because I get messages from people asking if something is true. Like, one of the things that I receive at least 7-8 times from folks was whether or not the National Guard was being activated to put in martial law. That is absolutely not true. But people out there, they some folks don't know, and so they'll reach out to folks, or they'll to ask if it's true. And in the cases of folks that have reached out to me, I'll tell them no, it's absolutely not. But some folks just share and move on, and that does a disservice to the flow of information. Social media is a double-edged sword, because it is an avenue to share anything, and it's for some, it's kind of hard to differentiate what is fact and what is fake news. So I would really advise people to make sure that you have these news organizations that you trust, that have gotten things right. And there are news organizations, like, everybody gets something wrong every once in a while. It happens. But the good news organizations will correct it. They'll go back and say, we were mistaken. Here's what really happened, and here's where we messed up. It happens, and the good ones will correct it. The bad ones will try to misinform, either for various reasons. But just make sure before you share something, before you spread information, that that it's true, that it's a fact.
Are there good fact checking? Is there a specific one that comes to mind if people have a question? Is there a pretty reliable fact checking tool out there?
I think it just goes based on preference. On some of like on Facebook, when I'm scrolling, I'll see somebody share something that's outlandish, and right underneath there will be something that says fact check. And even that sometimes has been called into question by the methods and organizations that Facebook will choose to do that.
PolitiFact and Snopes
PolitiFact,
regularly do like debunking fake news stories. So a lot of times, like, you'll see like someone will post a fake news story, and then right under it, someone will put a Snopes article saying that is not true.
Exactly.
So you can often like Google that, and chances are, if you saw it and it seems questionable, or if it is fake news, like, they will have written about it and let you know if it's true. Or with PolitiFact, they have like a meter that says like pants on fire or false, or like slightly true, or there's more nuanced, but yeah.
It's good.
Yeah, and I like Media Matters. Media Matters is a good. Media Matters is really good, but they more focus on the broadcast outlet of things. So that's one of my favorites.
All right, those are good. We'll post those on there. Roseanna, I got a different question from you to close out. Can you hear me?
Yeah.
Okay, good. As the therapist, as our local therapist here tonight, how have you dealt with this personally compared to like your professional take on this? How is this COVID crisis just observing something that's really affected you personally, where it's hard to express when you're trying to write from a journalist point of view?
Do you mean like concerns over? Ask that again.
Sure. Like, is there something that comes to mind that you didn't really you can't really express as a journalist, but it's been affecting you kind of personally as a human being, or a story that you might heard or something? How has this been different, affected you personally versus professionally, is a way I could say that?
I think it goes back to everyone's personal threshold for pain tolerance and what levels of anxiety and emotion that you can feel. I feel like this coronavirus has impacted people in every way, and that for people who have mental health diagnoses, it has likely impacted them more deeply, or people may even come out of this pandemic with mental health concerns that they weren't worried about before because they weren't having to think so intensely about the circumstances at which they're kind of living their day-to-day lives. I think that for me, I feel like I'm lucky to have coworkers who step in and talk and care about you and ask if you're okay, or ask if you maybe need to take time off. And then otherwise, I think it's really just important for anyone who feels overwhelmed to kind of think about what is the thing that will decrease that emotion. And so if it were me, like taking time off or taking a break from the news, I think that, the emotions that are happening for people are so personal in this time. We have people who are denying that this is happening and that they're getting very angry. Like, that's an emotion that's out there. We have people who are incredibly worried. And I think that whether it's an emotion or a news article, we have to check the facts about, what is within my control? Can I confirm this? Is this feeling too much? If it is, how can I take care of it? And then just try to make good choices for yourself and reach out for support when you need to.
That's good. All right. And we have one more question that just got texted, and I think it's very important, and we'll close with this, hopefully. This virus has impacted people in the marginalized community. Communities of color have been very hit harder. I saw some statistics where normally the average of people of color in our communities are 20%, and it affects them by 40%. How are we getting information out there to communities that may not listen to the traditional media outlets, people who speak Spanish, or are we translating some of this information so more of these communities can reach that? Can somebody speak on that?
I can say that we've made a lot of our coronavirus coverage free, so there's no paywall to read those stories, and that was specifically because it's a public issue that we feel is like kind of that dire that it shouldn't just be our readership and subscribers that get to view it. So that's one step that we've taken. I can say personally, a story that's coming out soon, I think maybe tomorrow or sometime this week online, is kind of a resources for immigrant families in South Texas, undocumented or not. Basically, what are the organizations that are trying to help those families out? And we've decided that we're going to do it in English and Spanish for that reason, to make sure that it's accessible to the right population and the right people. So those are some steps that we've taken, but I do agree that it's really important that this information gets out to the vulnerable communities and the ones that are the most affected by it. But hopefully with, our strong media network here, whether it's TV or public radio or, any kind of media outlet, that it will get through to those folks.
That's good. Joe, do you have any thoughts on that?
Yeah, there is a divide as far as information getting out to certain communities. I can tell you that from the government perspective, the city is doing outreach within communities that may not be as prepared. Yesterday, the city was talking about its outreach campaigns on the east side or on the south side, people that are bilingual going out door to door, putting door hangers on folks to let them know the dangers of coronavirus. So there are at the government level things that are being done to make sure that folks that may not get that information are getting that information. And I do think it is pretty startling, the disparity of people that are being impacted by this virus. And you look at some of the data that Metro Health has put out, African Americans, for instance, make up 7% of the county's population, but they are 11% of the number of positive cases. African Americans are also 30% of the deaths that have happened. So I do think it's very important that there is stronger outreach to these communities to make sure that they understand the risks, and that the reason that people of color can be more at risk is because of underlying health conditions. You have in Bexar County, we have high rates of diabetes, we have high rates of heart disease, we have high rates of various lung diseases, and that earlier today, Metro Health had said all but one of the 37 people who have died in the county had underlying conditions. So there does need to be stronger outreach to these communities to make sure that they understand the impact.
That's good. And Roseanna, any thoughts about this situation?
I think, we all can commiserate on how difficult it is to get the right information to the right people. And I think that newsrooms and city governments and public health departments all have to, have a level of integrity at which they operate on, and that hopefully the public then kind of follows suit because they understand the importance of what there is to say. I don't know that, there's no one solution for getting the information to all of the populations in need, but there is definitely the work that journalists can do and people in their own communities to look around and see if there are signs posted about coronavirus in all of the neighborhoods, or see if people have an understanding of where they can access information. I will say that people's interest in coronavirus, I hope, piques their interest long-term in following, whether it be health pandemics or things that are going on in city government in general, more than they were. And in turn, as more people access the news and care about what it means to them in their daily life as dramatically as they do this novel coronavirus, that, hopefully we'll be able to think of some good outreach mechanisms to get the information to those people.
And it is on us to keep telling those stories too, and to make sure that we keep focusing on those vulnerable communities and those inequalities that you see that are clearly an example of, the inequalities in coronavirus cases and deaths are very indicative of the city and people, how the city is segregated and how people are treated. And so it is also on us to make sure that we're showing that and telling those population stories.
And I think another thing that'd be helpful, and this has probably already been happening, but when different media outlets have different reaches, right? They reach different people, they reach different communities. And if we share each other's stories, that might be helpful. Like, oh, I heard this from TPR. And if I'm a reporter that reaches a different group, I'm going to share that so they get that information instead of just what we've been producing. And I think the more, it's like hospitals sharing information, the better the healthcare of their patients. And so if the media can do a better job, instead of thinking this is like, oh, this is our, we're competitors, we're out here. If we can start cross-sharing information, because we'll realize that, man, this health story from Roseanna will be really good to hear on KSAT News. I don't know, that's just something I think that we could do a better job in always. And sharing is a powerful way. And this is something that we can focus on during this pandemic. One last thing before we go around the room and just share how we can donate or subscribe. The last thing, I always make a joke that if you ever watch the Jerry Springer show, the last minute of his show has this really sane conclusion. It's like this one brief moment in the chaos where he talks about something positive. One story that I just watched unfold in front of my eyes. We've been going out and serving the homeless through Centro San Antonio. They've been using their trucks that say Centro, and they light up and they escort us around. Centro's there before we get there to create social distance. They spray hands of those who are homeless and chalk line the sidewalk, and they do an amazing job. The best way we can still deliver good food and create this kind of distance. And it gets chaotic. I mean, you have a lot of information to get out there. We've changed locations a few times where homeless people can get food. And there are two people I've observed, and one of them works from Haven for Hope. She's an outreach specialist named Valerie Solanas, and Morgan, and I'm blanking on her name. I'm actually writing a column for the Rivard Report about this. So once my terrible writing is edited, you can read about this. But they have gone out and for weeks and years maybe now, learned everybody's name that are homeless, right? That's their job, is they go around and they learn people's names. So in this crisis, if we have Morgan and Valerie with us, the whole mood changes when we have a group of homeless that need to learn information, that need certain care, because once you know somebody's name, the barrier breaks down, right? You're treated with respect. And when I watch these two amazing women in action do this, it really reminds us the power of community and getting to know each other, right? Getting to know each other's names. There's a name behind every person who's been laid off. There's a name of every healthcare worker that's putting themselves at risk. There's a name for the people who have passed away and haven't had a proper funeral, and they probably won't in the traditional sense for many months to come. And if we get to know these names, it reframes how we do things. It reframes how we respond to a crisis. It responds how to a problem that we have to solve together as a community. And I just really thought that was really powerful when they just walk up and say, "Hey, Scott. Hey, Elizabeth. We're glad you're here. Here's some information we have for you." If that homeless person has a lot of fear or anxiety or uncertainty or conspiracy theory, like, it just dies because you just said their name and they listen. And I thought that was a wonderful way that we all want to be treated. And that's one story of hope that I saw out from Valerie and Morgan, who have the same exact job, but one works for Centro, one works for Haven for Hope, and they drive around to get to know the homeless community, not only in downtown, but all over San Antonio. And just the power of knowing somebody's name, I think, really makes a big difference in a time of crisis. It makes us vulnerable, and we can't escape not helping if we know somebody's name. It makes it personal for all of us. So that's the conclusion, the pastoral response there to Pub Theology. So Roseanna, how can we help support the Rivard Report?
You can read us only and none of our competitors.
Hey.
We are a donation-based nonprofit news source, and so you can donate at any level to support us, and then also $25 a year makes you a member. Sign up for our newsletters. Make sure that you're reading news that has integrity. I feel like the more that we spread news that does, the more people will get connected to the Rivard Report and TPR and the Express News as we work to, share information that's correct. And so you could give us your money, but you could also read the news and continue to stay informed even after all of this kind of simmers down, because I think that probably in all of our newsrooms, we're seeing that people are very interested in this, and they're also waning in being as interested as they were when it was a little bit more novel. And that kind of tends to be how it rolls out. And so try to stay interested and keep visiting the Rivard Report even once you're not curious about the number of coronavirus cases.
Thanks. Silvia, how can we support the San Antonio Express News?
By reading us and becoming a subscriber. The site is expressnews.com/coverage. If you go there, that's how you can be a subscriber. You can choose print, you can choose digital, you can choose different versions of the two. And yeah, I mean, kind of what Roseanna said, I think all three of our mission are the same, which is about helping the public stay informed, letting you know what's happening in your community. And so we're doing the best that we can with that. Even if you, just want to try us on a trial basis, even if you just want to click on a few stories, I think there are a few free that you get before the paywall comes up. And you can just see if you like what you read. That's how you can follow our stuff.
All right, Joey, how can we support TPR?
You can go to tpr.org, and in the top right corner, there is a button that says donate, and you can donate any amount that you want, but we want to encourage people that you can become sustaining members of TPR, and that starts at $5 a month. You can give it any level that you choose, but when you become a sustainer, it helps us have a solid stream of donations coming into the station. So a lot of public radio stations use that model now. It used to be, it was, donate $60 a year, but now we have it to where you can set up your information with TPR, and as much as you like, again, $5 a month. We have some folks that give $30 a month, dollar per day kind of thing. And that's really all it takes to support public radio. Can also support us by sharing our stories and telling folks, and that not just TPR, but any news outlet, because when you share a news story, you are telling your friends that you trust this news outlet, that you trust the information and the reporters that are gathering all of that news for you. And so it builds that level of trust within that, or for that specific media organization. So, if you see something that Roseanna, Silvia, or myself have written, or any of our colleagues have written, share it and let people know that you find it interesting, because that helps, again, build faith within for that news organization. And we are a public radio station, so we are nonprofit, and we about 50% of the money that comes into the station are individual people that listen to us. So you can, again, go to tpr.org and donate there. You can find us, you can find all of our stories posted there as well. And you can listen to us at 89.1 FM for our news and information station, and 88.3 for classical music.
All right, thanks, guys. Hey, y'all have some big fans over here before we go. Emily David Donaldson from the says they're so lucky to have Roseanna. Jackie Silva was really giving shouts out to Joey and his coverage and the stories that he did on Southern Springs. And look, Silvia, your grandma is watching. Abuela.
Grandfather in Jayuya, Puerto Rico, in the mountains of Puerto Rico, is tuning in right now. Hola, abuelo.
And it says, Silvia, thanks for being a great big.
Gracias.
All right. So look, people love you. Thanks, guys, for being here. Thanks for taking time on our little thing that we do, mainly at the Friendly Spot. We do want to remind people to go out and support local places all around San Antonio and the places that are hurting and doing to-go food. Please support local. The Friendly Spot supports us by usually allowing us to meet in person since 2016. Roseanna and Silvia have been on before. They've both been guests and hosts for Pub Theology. And Joey, thank you for coming on for the first time, I believe. Guys, stay safe out there. Again, support local journalism. Go subscribe. Make a donation to the nonprofit journalism. Subscribe to the paper, and we'll do all we can to stay connected with you guys in this season. Thank you guys for being here, and we'll end this program now. Thanks, guys.
Thank you.